Welcome to Talking Tech Journeys, hosted by me, Ben Whiteley of BPM Tech. We're delighted to bring you season 1 of Talking Tech Journeys. The aim is clear, to bring you some of the most engaging and respected figures within tech and transformation, providing a snapshot of their journeys to share knowledge, ideas and insights on all things tech and transformation. Sit back, relax and enjoy the journey. Hi, welcome to Talking Tech Journeys. I'm Ben Whiteley. I'm delighted to be joined by Dr. Julian Nesbitt, GP and Clinical Entrepreneur, founder of Dr. Julian Medical Group, who provide tele and virtual health solutions to care providers and are on a mission to reduce waiting lists and helping people feel better faster. Hi, Julian, how are you?
Hi, Ben. Yeah, very good. Thanks. Thanks for having me. How are you doing today?
Yeah, good. Obviously, looking forward to delving a bit more into your background, experience, and your journey from GP to Healthtech Entrepreneur.
Sure thing.
Good. Well, without further ado, let's take you back then. How, why, and when did you sort of first become interested in health and technology?
Yeah, I guess. Well, health was interesting. I was always interested in science, and I guess I was always interested in people. And I don't think I wanted to work in a research lab, so I thought actually trying to be a doctor was probably the best choice for me, because it could kind of mix that science and people together. So that's I think when I was at sort of secondary school, I guess that's when early on in secondary school, that's when I kind of wanted to be a doctor, I guess.
So is there any sort of spark? Was it just literally to sort of explore, or any sort of particular drives and motivators behind that?
Yeah, I mean, I think it was a real. I think being a doctor, I think, is just a real privilege. Like the way that you can, sort of have that confidence of someone to tell you your, inner darkest secrets, etc. And I think, well, personally as well, I went through a bereavement. My father died when I was younger. I think that also gave me some form of probably inner kick to say, can we help people, etc. And I think, obviously that was, and the sort of love of science that I had, I think that was kind of the obvious career path that I kind of ended up wanting to go down.
So just in terms of like your first job then, I mean, how did it sort of shape you on your journey? And you've touched on sort of technology and science. I mean, how important was it back then?
Yeah, I think I kind of what I did in terms of my first job when I was sort of at school was I worked as a tutor in the summer holidays to try and earn some money, but then my sort of first job as a doctor, really, I guess you go through that process, don't you, of and people are going through that now or about to start as an F1, etc. And I really loved it. I thought it was I thought it was the right choice. Tough, but I mean, it's a real privilege, isn't it, to be a doctor? So
and you've been sort of the NHS over 10 years and counting, really. So I mean, how's it sort of changed over that time?
Yeah, well, yes. So partly why I'm now doing what I'm doing, I think, is just the fact that over time the NHS is just becoming more and more more tough for everyone, isn't it? I mean, we know that waiting lists are going up. We know that the population is aging. We know that the reality is that the NHS systems were set up a very, very long time ago, and we're now living in a different world, in a more modern world. And to me, we've got to try and initiate some change to try and keep up with that world. So I think it's really tough out there, as we know. Everyone's striking, everyone's on big waiting lists. We're going through a very, very tricky time. We've got to make sure that healthcare is free for everyone and available to everyone, I think, and that still is very possible. But we've just got to work out the best way of doing that and probably bringing things into the modern age, in my opinion.
Yeah, so you're on about modern age, change, transformation, innovation. What would you say your time with the NHS sort of the biggest barriers and challenges in terms of that change, transformation, innovation sort of piece?
Yeah, so there's different things in it. So as a doctor, personally, going from that side of it rather than from the sort of bigger global side of it, national side of it, I think as a doctor personally, there's I mean, it's a very tricky environment as a doctor, right? What job do you go into where you say you're not allowed to go to your own wedding because you're supposed to be on call overnight?
Yeah.
You know, that happens to people. People have to move across the country with their partner when they have kids because they haven't got the right job for them. So, you know, there's a lot of issues in that sense. Those are lots of challenges in recruitment and retention, I think, from that perspective. And then I guess from a larger perspective, as I say, you know, the waiting lists are going up, healthcare is getting more and more complex, and we need a system to try and work out how we can help resolve this, you know, in a more modern age.
Yeah. So, I mean, summarising and pulling from your sort of NHS experience, you've also just talked about the various health and social care problems, you know, the waiting list, recruitment, retention, clinician burnout, inefficiencies, etc. I mean, so sort of at what point did you realise you could help the NHS or the clinicians sort of driving innovation using technology?
Yeah, so well, my original inspiration was actually I was an A&E doctor for a while. I think I was on an A&E night shift, and I came across multiple patients in a row who had tried to end their own lives. I then saw someone with a clipboard come down and do a risk management assessment, which literally was a clipboard of a few questions that then got discharged with no support. And I was like, hang on, what the hell's going on here? They were, you know, all on very, very long waiting lists to get help. And I thought there has to be a better way of getting someone help faster and quicker, and rather than this sort of clipboard, let's get out of this department assessment. And then I looked at the technologies that we were using in the NHS, and they're just very outdated. And I thought to myself, why can't we have a much better technology platform that can connect people far more easily to the right person for them? And if we did that online as well, you could then utilize a much wider network of people, and then try and give patient empowerment, patient choice, and include the patient. So I was like, why do we not have a system that has a patient-facing side where patients can book their own appointments, access their own resources and tools, you know, do their own assessments, do all of that stuff themselves, empower them and get them the right help more quickly and more conveniently, that can link in with the sort of back end. So I guess it was me looking at technologies and going, we really don't have up-to-date technology. I feel like this can really help. Let's look at other sectors, banking, etc. You've all got your own personal app. I think we need that in healthcare, and trying to do that. But the barrier, I mean, it's very tough, right? Because the NHS is very fragmented doing change in the NHS. I mean, we can go into that, but I think it's a real problem that needs solving, and that's, I guess, my drive to that.
Good, which sort of falls in nicely to, you know, when you set up Dr. Julian Medical Group circa 2016. I know, we sort of mentioned the sort of timestamp on that, but I mean, so how was the transition from working sort of full time in the NHS to ultimately starting a tech startup, Julian?
Yeah, I know, that's a really interesting question, because I'm trying to it's all been a bit of a whirlwind roller coaster that I can't really even fathom. I remember, I think you have to have serious drive and try and keep going, and the number of barriers that you face is huge. I think I was a full-time doctor for probably 4 or 5, I think it was 4 years post doing it, and I think it was quite a slow start, because I was on my own sort of thing, you know, doing it very not properly, I guess, for a while. And I didn't really go out and raise big funding at all. I've mainly bootstrapped it. So it's kind of different to, and again, I first time founder, didn't know what I was doing. So I kind of, you kind of learn as you go along a bit. I was doing, I mean, I had quite a lot of help along the way, which was absolutely necessary. And you've got to try and find the right people that understand how to help. I think, you know, when I first started, I didn't have a technology platform. We then ended up having a very not a great one at all, but I thought to myself, we need to connect people with clinicians, with therapists. I managed to get my first break from an NHS service, where we then started building the technology, but actually it was me phoning up every single patient going, I'm really sorry about the technology, but I've got some great therapists. please excuse me, we're building the technology, but let's connect you to a good therapist. And then from there, you can then start building the technology, getting the feedback from the patients, getting the feedback from the clinicians. So by sort of using the money that you can earn from providing the service, you can then start to build the technology. I guess that's how I did it.
Good. So, I mean, just in terms of for the viewers, I mean, Dr. Julian Medical Group, I mean, who are they and what sort of problem do you tackle?
Yeah, so we are doing a few things now. So our core business is to improve access to mental health care services, and we do that by connecting people with clinicians in a much more personal, empowering way. So we offer patient choice. People all get their own dashboards. They can book their own appointments. We match them to the right person for them. And we mainly do telehealth, or we're starting to do some face-to-face, but we have a network of about 350 now or so clinicians covering all mental health disciplines, and we're quite established in that area, sort of covering off a number of quite a few NHS trusts across the country, as well as working with charities, occupational health companies, and other organizations that need therapy. And we can set up different platforms for each organization and white label them, and then provide that therapy care with the patient getting their own dashboard. Having built the technology now, though, services were coming to us saying, could we use your platform to run our own services on? And some of the benefits of the platform that we have, i.e., that patient-facing side and doing things more efficiently and empowering patients. So then we've now started licensing out our platform as well, so that services can use our platform for their own, for their own service and for their own clinicians. And then there's a sort of crossover where they can use our platform for their own, but also they can dip into our network if they need extra capacity.
Yeah. Excellent. So, I mean, just in terms of sort of the sort of beginning, the perception of the NHS clinicians in terms of teletherapy, I mean, how was that at the time?
Yes, exactly. So back in 2016, 17, pre-COVID, there was a lot of people did not believe in it. So I had a lot of resistance back then as well. Interestingly, though, there was actually quite good evidence already out there that it was equally, if not more, actually more effective than face-to-face care. And, the obvious reasons of being able to have a wider network, find the right clinician, have your appointment in the comfort of your own home with your slippers on and a cup of tea, rather than having to travel to some place that you don't know where it is, and all of that stuff. And that's what we sort of pushed that message on. But pre-COVID, it was still very niche. And then it was interesting. So we were getting more and more sort of traction as the years went on. But then, obviously COVID was then suddenly like, oh yeah, everyone can do this online. And then it became very mainstream.
Yeah. And the other thing, speaking to sort of tech startups, people like yourself, sort of adoption of new systems, obviously working alongside current pathways, improving sort of step by step, or sort of creating a whole new pathway. I mean, sort of challenge and adopt. What are your thoughts and some of the the obstacles that you had to overcome from that perspective?
Yeah, so I mean, if you're going to innovate in the NHS, you can't start by changing a pathway. You have to work with the current pathway, because it's just very, very tough to come in and completely change everything all at once, which is why I think a lot of people can struggle with adoption. So what we did to start with is you fit in to the current pathway and the current way of doing things. And I always like to sort of call it innovate 1 to 2 steps ahead rather than go 10 steps ahead. It's like, if you try and put in a artificial chatbot therapist now, it probably isn't going to get adopted immediately. You still need that clinical touch. You can do that by fitting into the pathway and augmenting, but not replace. Do you know what I'm saying? So for me, you've got to try and work with the system and then innovate a few steps ahead of the system and gradually change things. Potentially not such the case in more innovative organizations, but when you've got a beast like the NHS, you've got to sort of work with what you've got and move it more slowly, and it takes a long time.
Sort of iterative steps along the way. Yeah, good. So I mean, just in terms of obviously the product, then I know you've touched on it in terms of the digital platform, but also the tele side of things. In terms of sort of MVP, product fit, pivoting, I mean, all part of, tech entrepreneurship, no doubt. So you able to just sort of discuss the product and how it sort of evolved over time?
Yeah, we actually, so the easiest place to start was trying to create a private patient app where people could find a therapist. Obviously, that's really tough because you have to do loads of marketing to sort of get private people to book, but that was trying to get the initial MVP out. And as I say, it wasn't built very well. Then I got my break by being persistent and asking different organizations and, go for the smaller ones. Do you need extra capacity? And I think because the problem was so great, there was no capacity for people in the system to have therapy, i.e. waiting lists were, a year. It's so long. That they were any way that you could help offload some of that, people were grabbing at. So because that problem was so great, that's why we've managed to get in. Because if you've probably heard this so many times about solving a problem that isn't a problem, but you making sure that you're solving that problem that people need solving, because they needed that problem solving of their waiting list was so long, they had KPIs that if they didn't match the waiting list targets, they were going to get punished. They were desperate for help, and therefore that's the way we got in. And then from there, as I said, we could start to learn from the technology that we had, and then gently keep building it up. And over sort of 8-9 years now, we've ended up with a very, very comprehensive platform.
Good. Which we're sort of going to come on to the the AI accountability and things like that. Just before we sort of move on to more sort of recent sort of time in terms of yourself, case studies. You've probably worked and you very proud with some of the results and outcomes. Are there any specifics that you'd like to share?
Yeah, we've had numerous sort of studies done evaluations done on the platform and stuff, and I think we've got really very, very high ratings when it comes to patients and a very, very high Trustpilot score, etc. And our patient experience questionnaires. So that's what kind of keeps you going, because that's what's important in life, is helping people, and seeing how you change people's lives, I guess, is what keeps me going and what keeps a lot of clinicians going in that sense. So that's, I guess, the most important thing. And then we've had evaluations done which has shown that using our platform we can double engagement rates, we can halve the did not attend rates, we can improve recovery rates, and more recently as well with other organizations that use our platform, some of them have said it can improve efficiencies by up to 10 times as well. So I think that's been really good feedback. About to conduct a whole load of new evaluations on new products that we're releasing, such as our digital therapy homework, to try and get people more engaged in doing their homework, etc. So yeah, we're constantly evaluating and constantly getting feedback to sort of work out how else we should build our platform going forward.
Great. So I mean, obviously you've touched on some of it there, so some of the feedback, and it's interesting in terms of the AI automation of clinical pathways, data analytics, personalization of care, choice, patient outcome. I mean, what does the sort of future hold in terms of your platform? You sort of touched on there in terms of the homework and things. I mean, how are you sort of using the data to sort of personalize the care, drive outcomes, and ultimately increase choice?
So my core foundation, I guess, belief on a lot of this, I mean, we've actually come up with a new why, and I think, like, for me, I feel like in a connected world, I don't think anyone should wait for healthcare in general if we can connect things properly and we can personalize care. So hence why my real driver around that was every patient should have a personalized patient dashboard and a patient-facing side, like you have with your banking, where you have your patient app. Every single human being needs to have that personal side. I know we're trying to do some stuff with the NHS app, but actually the NHS app could be a gateway in to a lot of things. So for me, it's that having a patient-facing app where if you've got your own personal app, that can be whatever care pathway you're on. You could have your own self-help tools and resources on there, the relevant assessments you need to do on there, and then connect you with the different care pathways that you need to be on. So if you need to go and see a physiotherapist, you can be on that pathway. If you need to see at the same time a mental health professional, you can be on that pathway. But by having this overarching system that can facilitate all the infrastructure around that, which is what we're trying to do, you can really put the patient first. And I think, again, probably some of the outcomes that we've learned is 90% of people that we've been able to show on our technology can book themselves. And if they book themselves and they can see when their appointment is, they turn up to that. They're more engaged in it.
Yeah.
And actually giving them choice is so important. So you can then use, as I say, as you were talking about, the data and the AI is very interesting. As the bigger data set that you collect, you can start to analyze trends and go, okay, what type of human being works best with what type of resource, with what type of therapist, with. So there's a whole load of sort of iterations that can be done going forward. But for me, the key point at the beginning was making sure that person is on the right care pathway. So getting the assessment done correctly. In mental health, for instance, are they going to work best with a CBT therapist or a counselor or whatever? And then giving that person choice of that right clinician. And in fact, we let people contact their clinician beforehand. And in therapy, there's such a big thing that you need to have the right therapist. So a lot of people have said, oh yeah, I did CBT, it was useless, it didn't work for me. And a lot of the time that's because they're not engaged in it, but and they don't get on with their therapist. So if they can get on with their therapist and they're the right fit, then they can be engaged and then it will work. So that's the key. And you've got to focus on engagement of that patient and personalization, so that person can feel part of their care.
So the data element is pretty much going to be really critical to the personalisation of care, and ultimately a win-win for both your patient and clinicians.
100%. Yeah, 100%.
That's certainly something to keep an eye on moving forward, and no doubt there'll be a lot of work from your perspective and drive a lot of value and benefits. So good. Yeah,
and then the more data you can collect on a system, the more accurate you can start to become. And again, you've just got to constantly get feedback as well. So just making sure that you're constantly analyzing those things is very important. I think, the other thing when you're mentioning AI, like, again, I am all about choice. And I think some people respond really well to an AI chatbot and some people really don't. I think, again, it's around giving people that choice. But my personal passion is around augmentation rather than replacement, or doing replacement where is necessary in very, in small cases, etc. But the AI could also help people between sessions, and again, trying to do this with our homework and stuff, just making sure people are there. But I guess my personal belief is that we're still human beings at the end of the day, and human connection is such an important thing, especially when it comes to mental health, that we definitely can't replace all of therapy with an AI chatbot. I think it can be used in certain areas.
No, I agree with that. So, and obviously all the hard work, you've recently had a couple of awards, recognitions. I know you're part of the NHS Innovator and Accelerator program. So, I mean, how have they sort of benefited you as a health tech entrepreneur?
Yeah, there's been I've gone around the block actually with the accelerators, and they've been amazing, I have to say. I guess the first one was the sort of NHS Clinical Entrepreneur Program, which I'm a great believer in. I think it's been a real help. I was on the sort of cohort 2, which was quite an early cohort. There was less people on it at the time, but that was, I think, actually thinking back on the accelerators, the biggest thing was you're not alone and you can do this, and it's about motivation, because you feel very alone. And you're kind of like, what am I doing? And you shouldn't be doing this. You should be working as a doctor, etc. But kind of gave you the permission to keep going. And I think that was key. And then obviously all of the benefits from them of over the years, learning certain things and how best to run a business, how best to do certain things in the NHS, etc., which is all very, very, very helpful. But the network is probably the most valuable, and just the permission to keep going is the key. I think, for me, what I say to a lot of entrepreneurs, it's the resilience thing that is one of the biggest factors. Obviously, you've got to have something that's worth solving, but if you have the drive and resilience, you'll get there. The number of things that go wrong is indescribable, but if you just keep going, then it so long as there is a problem to solve, it will work out.
Yeah, I mean, solving a problem that exists, but it's also what I get speaking to people like yourself is it's that passion as well, passion for solving that problem. And like you touched on, the real life examples of your why as to, why you could really make a difference. I mean, sort of just sort of coming on to that. Obviously, you're still practicing GP. You see and understand the day-to-day, pain and pinch points of health and social care, and obviously we've talked about the, with your sort of tech entrepreneurship. I mean, with your sort of tech entrepreneurship hat on, what traits? I know you just touched on a few of them there.
Yeah.
What do you think makes a great entrepreneur?
Yeah. Okay. Well, as we said, like the first, number one, passion. Number two, resilience to keep going. And then number three, knowing your weaknesses. So certain people, we all have a lot of weaknesses, and then being able to inspire and motivate a team around you, and making sure that you have the right team around you, because it's literally your team that make you who you are. It's literally your team. It's the people around you that create the success, and it's the key to recognize that and make sure that you have the right people around you that you can inspire and motivate them to do that. Because as I say, when you're working on your own, you kind of muddle through. But it's I mean, I was doing the accounting, and I'm look, that's not my forte. So you've got to have people around you that so it's about building that team, I think. So that that's key, really.
Yeah, I was speaking to another NIA fellow, and he sort of summed it up, sort of delegate to elevate, which I thought was a nice sort of point in terms of, like you've said, playing to your strengths, but then sort of building the team around you to complement. I mean, in terms of sort of, driving and growing and scaling, how easy is that in terms of instilling that your vision and views across the whole business?
Yeah, I think, well, again, so long as you're passionate about something that needs solving and there is a problem, then it's not that difficult to sort of do that. So mine is, people are waiting a long time for mental health, and now actually healthcare. So how can we improve that with a technology platform that can help connect people in a better way, can help reduce the administration burden, and provide a much, much stronger modern infrastructure? So I guess that passion that I have to do that can help inspire people around you to do that. So it just depends. If you don't have the passion or motivation, then it will be hard to inspire people. But if you've got that and you can see how that's going to help people, I think that's what matters. I think in healthcare as well, it's much easier, because at the end of the day, the whole point of this is to try and help people, right? That's
correct.
What gives people satisfaction in life, and it's probably, if you look at how people are, what makes people happy, giving to others and helping people is the biggest thing that can make someone happy. Forget money, forget all these things. Giving to other people and helping people makes you happy. So if you're able to do that in healthcare, we're in a privileged position where that, if you can do that can inspire and motivate lots of people.
Yeah, no, absolutely. And that's very prominent with, this conversation and others. So, Well, look, Julian, many thanks for your time and great talking today. There's lots of great insight for someone who's obviously, within the NHS and a digital health entrepreneur. So, to our listeners, it'd be great to hear your thoughts and views on the future of telehealth and lessons from a health entrepreneur. Thanks for listening.
Thanks, Ben. Thanks for having me. If anyone wants to get in contact with me, just add me on LinkedIn. Thank you.
Fantastic. Thanks, Julian. Thanks for listening. We hope you enjoyed Talking Tech Journeys, and we'll catch you next time. Good company and colleagues in a career make the journey more rewarding. If you did enjoy, please take a moment to subscribe, rate and review us on your favourite podcast platform. It really helps us reach more listeners like you. Don't forget to follow and join the Talking Tech Journeys, the podcast group on LinkedIn, where you can join in debate and message us directly if you'd like to be considered as a guest, have any questions, comments or topic suggestions. You can also email ben.whiteley@bpmtech.co.uk. Until next time, enjoy.